Okay, once a person has lost weight following this surgery, you're really at square one with anybody else who wants to keep their weight off. So you have to maintain that weight loss by maintaining the behaviors that other people do to keep their weight off. You have to make healthy food choices, you have to eat moderate portions of food, you have to exercise on a regular basis. It takes a lot of work to keep weight off, but you can do that. That's why you're having this procedure. I want to talk a minute about yo-yo dieting. Chances are that, like a lot of other people coming in for bariatric surgery, you've been a yo-yo dieter. Most of you know what that is. Yo-yo dieters go on diets, lose weight, gain their weight back, go off diets. Okay, it's kind of like this. You go, here's your weight, up here. You go on a diet, your weight drops. Once your weight drops, you go off of a diet and you gain your weight back. Now you're up here with your weight again. You go on a diet, lose your weight, off a diet, gain your weight back. You have to be careful because I think sometimes people have a subconscious thing going on after this surgery that they lose the weight and they think it's time to go off the diet. This is not something you can go off of. This is not a diet. This is a lifestyle change. And if you think that you can go off of this once you've lost your weight, you're going to end up back in the same position. So again, I'll say it again, you have to continue the same healthy behaviors that led to weight loss in the first place. And we'll go over this many times. Healthy diet, moderate portions, a lot of exercise. Okay. You don't want your weight loss surgery to be just another diet, okay? And it can be, but it is one heck of an expensive diet if that's all it resorts to. Instead, you have to make choices to have a different way of experiencing life. All right, let me talk about the choice thing for a minute, because remember, eating is a choice. To put something in your mouth or not put something in your mouth really is a choice. Eating is a very active process. Usually our eating begins with a trigger. It might be you saw a commercial on television, or you hear a commercial in the car for your favorite fast food place. Eating, though, doesn't just happen. There might be a physical trigger, an emotional trigger, but you have to become very conscious and learn to think about your eating in terms of what leads to it. Because then you won't say, I don't know how that happened, I just wound up at the drive-thru. You got to learn to recognize the cues and do something in the process to interrupt the process before you get to the point where you're eating the food. So my point again in emphasizing this is so that you don't make some common mistakes that lead back to the gaining of your weight. Every year Harvard hosts a conference called the International Conference for the Practical Treatment of Obesity. One of the things they say at this conference, where experts from all over the world gather, is that people who are overweight or obese are truly experts themselves at knowing how to lose weight. What they don't know necessarily is how to keep the weight off. What I mean by that is, you know you have to eat right to keep your weight off, but what you might not know is how to get yourself to stay away from the food when you're at a family reunion and there are 35 main courses and 75 desserts. How do you do that? You also might not know how to motivate yourself if you find that you've gained a few pounds. Sometimes it's hard to overcome the stinking thinking that's associated with temporary slips. It's also difficult to know how to get beyond the feelings of helplessness and hopelessness that you might experience when you may have gained a few pounds. Also, you might not know how to set and establish realistic goals and expectations for yourself. Remember, knowledge alone is not power. Knowledge is a good thing. It's good for you to be knowledgeable about fat grams and carbohydrates and calories and all of those things, but that knowledge alone will not do you much good unless you put it together with action. So knowledge with action can be very powerful. You have to utilize that knowledge in action in order to live a healthy lifestyle every day for the rest of your life. So remember, it's not sufficient simply to have the knowledge. but you must have the knowledge with action to acquire your goals of sustained weight loss. Okay, and to get through those difficult situations. Let's talk about those action steps that will lead you to your goal of sustained weight loss over time. You must do one thing to begin with, and that is to accept the fact that nobody can do this for you. Sometimes that's not a fun thing to accept, but it's true. Now that's not to say that you're not going to need other people to help you along this process. You most definitely are. You're going to need people to help motivate you, to cheer you on, to help you remain accountable, to listen to your struggles, and to help you celebrate your successes. But you must make the choice to learn what you have to do, you must learn how to do it, and you must accept complete responsibility for the fact that you are the one that must put forth the effort every day to get it done. Notice again that I use that word choice. You have a choice about all of the things associated with your weight loss and keeping it off. Remember, for every choice we make, there is a consequence that goes with it, whether that be good or bad. Ultimately, you're the one that has to implement change in your life if you are to lose the weight and keep it off. If you choose to accept this, you're taking a big responsibility for yourself, follow through with the behaviors, and you'll lose weight. If you choose not to accept the fact that you're the one who must do it, instead, maybe you're hoping other people will do it for you, you're going to be disappointed because nobody else can do it for you, and the result will probably be that you either don't lose weight or that you put it back over time. Okay. If you choose to learn to do what it takes, that means that you're going to do things like read the books, you're going to listen to the people who have been down the road before you, you're going to keep journals of what you eat, you're going to keep exercise journals, and if you do those things, again, those are the choices that lead to sustained weight loss. All right? So you can choose to put forth the effort to implement the things that keep you from gaining your weight back, and the result will be that you will keep your weight off. Okay. I'd like to talk to you a minute about something that I learned from a wonderful man named John Friel. He's a psychologist who's done a lot of work with children who grow up in homes where there's a lot of abuse or alcoholism. He talks about the difference between childlike thinking and adult-like thinking. What he says is that children think along the terms of, I'm trapped. I don't have a choice. I wait for other people to make my life better or to make me happy. I wait for other people to change. I wait for other people to give me what I deserve. You're going to have to be careful to avoid that kind of thinking as you go along with your weight loss program. What you want to do is have adult-like thinking. Adult-like thinking says, I'm accountable. In this case, I'm accountable for learning what I have to do and for doing what I have to do to keep my weight off. I find appropriate ways to meet my needs. Adults find their own ways to get their needs met. They don't wait for other people to do it for them. They take charge of what needs to happen. So if I need to go to the gym, then I need to find a way to get there. If I need to make time in my schedule, then I make the time to do that. Adults also say, I can choose not to change, but then I don't blame others, or I choose not to change.